So a lot of chemotherapy drugs cause nausea and vomiting. We're much better in treating those now than we were 10 or 15 or 20 years ago, 30 years ago when I started my practice. There is a group of drugs that cause a lot of trouble, which we called HEC, highly emetogenic chemotherapy. And in that situation, if you don't give anti-emetic or anti-nausea medications, 90% or more of patients will have trouble with vomiting. We're much better now at decreasing vomiting, not as good at decreasing nausea there. So standard treatment for those patients in these days are to give 3 or 4 drugs, a 5-HT3 receptor antagonist, an NK1 receptor antagonist, dexamethasone, and olanzapine, which is the new kid on the block. A recent study, New England Journal of Medicine, published last year, demonstrated that with adding olanzapine to the 3 standard drug regimen that was there before, that actually improved the chance of no nausea and vomiting by 10 to 20 percentage points. So a nice benefit in that regard. So treating patients these days who are getting highly emetogenic chemotherapy, and let me back up, the downside of the olanzapine is that it can cause some drowsiness. It's a relatively cheap medication. It's an antipsychotic medication. If people have trouble knowing that they might be taking something that's used for an antipsychotic medication only for 4 days, then that can be discussed. But it can cause some drowsiness in some patients. So in my mind, and how to put this into practice, when I see patients who are receiving highly emetogenic chemotherapy, I have 3 things I recommend that we can go with. 1 is for them to get the 4-drug regimen. 2 is for them to get the 3-drug regimen, and that I give them a prescription for olanzapine, and that they choose, if they start to get any nausea or vomiting, they start taking the olanzapine, not wait until it's a big bad problem. But this drug also seems to decrease nausea and vomiting that occurs, not just preventing it. And the third option is to give them second option is give them a prescription, have them fill it, which is only about $15, and then take it if they need it. And the third option is give them the prescription, don't have them fill it. If they get nausea or vomiting, go to the grocery store, the drugstore, and get it filled in there, which might take 6, 12, 24 hours before they do that sort of process. But those are the things that are available these days. Continued efforts are going on to ask, is there things that we can do that make it even better with less side effects from the drugs that we're giving to try to make it better?